T1 to L2 region of the spinal cord. And so in that T1 to L2 region, not only do we have anterior horns, not only do we have posterior horns, but we're also going to have lateral horns. And in the lateral horns are the cell bodies of our preganglionic sympathetic neurons. Because we're originating in that region, it's also known as the thoracolumbar division. So how do we get this information out? Because this sympathetic information is going to end up everywhere. So we got to get it away from the T1 to L2 region of the spinal cord. And so we're going to see that it's going to supply the visceral organs and all the visceral structure in the superficial and somatic part of the body. So that means everywhere. Everywhere in the body we got to get. And so what we're going to see is that the cell bodies of our preganglionic or presynaptic neurons are in these lateral horns. So now we're going to bring in this yellow portion, these lateral horns here. In there, we have our cell bodies of our preganglionic sympathetic neurons. They're going to send their axons out the ventral root because we're keeping this motor information. This is, remember, all the information here is going this direction. We're maintaining that. So the information is going to go out that ventral root into the spinal nerve and jump through what's called a white ramen communicantase into a paravertebral ganglion on the sympathetic chain or trunk. That's a lot of words. Next to what we're going to see, and again here we see a section here, not only do we have anterior horns, not only do we have posterior horns, but we have lateral horns. So we know we're somewhere between T1 and L2. In there are cell bodies of our preganglionic sympathetic neurons. They send their axons out the ventral root into the spinal nerve and through a white ramen communicantase onto a paravertebral ganglion on the sympathetic chain or trunk. Along each side of the vertebral column, sitting on the transverse processes, are going to be the sympathetic chain or trunk. And as you go along the sympathetic chain or trunk, there are going to be ganglia on there. Those ganglia are paravertebral ganglia. Para means next to. So those ganglia are known as paravertebral ganglia. They're sitting next to the vertebral column. Once they get in there, and why they're going through what's called a white ramen communicantase is because remember, I mentioned this before, the first neuron in the circuit is going to be myelinated. So it's called a white ramen communicantase. So it's going to take that white ramen communicantase into the sympathetic chain or trunk, specifically into that paravertebral ganglion. And once it gets in there, one of three things can happen. And those are listed here, but let's look at the picture as we talk about it. So as we look at this, we have our ventral horns, we have our dorsal horns, and now we have lateral horns. So we know we're somewhere between T1 and L2. In there are cell bodies of our preganglionic sympathetic neurons. They are going to come out the ventral root into the spinal nerve, take the white ramen communicantase into the sympathetic chain, which lies on either side of the vertebral column. It specifically comes into a paravertebral ganglion. Para means next to, so next to the vertebral column ganglion. These are sympathetic ganglion. And in there are cell bodies of postganglionic sympathetic neurons. Now what can happen? Option one. This is in the red. And it's when you look at the typing, it refers to option one here. Cell body of our preganglionic sympathetic neuron sends its axon out the ventral root into the spinal nerves through the white ramen communicantase into the sympathetic chain. It can synapse there with a postganglionic neuron, sympathetic neuron, send its axon off a white ramen or gray ramen communicantase, and it's gray because it's unmyelinated, and then into this ventral ramus or into this dorsal ramus, and then out to where it needs to go at that particular level. Great, that gives me information into the spinal nerves that are from T1 to L2. But we need to get it more places than just that. So that was option number one. And this got us information into our spinal nerves and all their branches from T1 to L2. But what about all the other spinal nerves? We want to get sympathetic information into those. We want to send information up. We want to send information down. This is option number two. So this is in the green. These are the cell bodies of our preganglionic sympathetic neurons. They're going to send their axons out the ventral root, into the spinal nerves, into the sympathetic chain, and it could go up the sympathetic chain or it could go down the sympathetic chain, which runs along the entire vertebral column. It can go to a different paravertebral ganglion. First neuron synapses with second neuron goes off the gray Raman communicantes and out to where that spinal nerve was going in its branches. So now this got us information to all the different spinal nerves. This got us information heading up towards the head. This got us information heading down towards the pelvic region. But that really didn't get us information heading towards the gut and heading towards the viscera. And that's going to be option number 3. So if we want to go to the viscera, this is going to be option number 3. Here's option number 3. Here's the cell body of our preganglionic sympathetic neuron. Sends its axon out the ventral root through the white Raman communicantes into the sympathetic chain and goes, you know what, I'm going to go to the viscera. So it jumps off without synapsing. But remember, it's sympathetic. It can't go very far before it's got a synapse. And when it comes off as a splanchnic nerve because it's a wandering nerve. These splanchnic nerves can have all these different names except pelvic splanchnic, because if you see pelvic splanchnic, you should be thinking parasympathetic. So all these other splanchnic nerves, and it gets instead into a prevertebral ganglia. Pre means in front of. And these prevertebral ganglia are sitting on things like the aorta. And it gets into these ganglia that are sitting on the aorta. First neuron synapses with the second neuron goes all the way out to what's being innervated. And that's option number 3. So option number 1, get onto the sympathetic chain, synapse, get right back off. Option number 2, get onto the sympathetic chain, go up the chain, go down the chain, synapse somewhere else, and then get off. Option number 3, get onto the sympathetic chain, jump off without synapsing, but just go around to the front and synapse there instead. And then go the rest of the way out to what's being innervated. Questions? So we had 2 different types of rami communicantes associated with the sympathetic chain. We had white Raman communicantes and gray Raman communicantes. White Raman communicantes is how we got onto the sympathetic chain. Gray Raman communicantes was how we got off the sympathetic chain for option 1 and option 2. So everybody uses the white Raman communicantes. So options 1, 2, and 3 use the white Raman communicantes. Only options number 1 and number 2 use the gray, because if they jump off without synapsing and form a splanchnic nerve, they're not using those gray Raman communicantes. So what's the difference? The white Raman communicantes are considered white because they're myelinated. And remember, these are preganglionic sympathetic axons. And you only have that information coming out from T1 to L2, so that's the only place that you find these white Raman communicantes. So you only find a way onto the sympathetic chain from T1 to L2. But you've got to find a way off everywhere. And when you get off the sympathetic chain through option 1 or 2, those are postganglionic sympathetic axons, and they're found all along the vertebral column. Now this isn't a chart you need to memorize. The point of this chart is to show you where sympathetic is actually ending up. So you can see that just from T1 to L2, this region of the spinal cord coming out from the lateral horns, we're going to get information to the head and neck and heart, the bronchi, to the lungs, to the upper limbs, to the esophagus, the stomach, the spleen, the pancreas, the liver, the small intestine, the kidney, the reproductive organs, the lower limb, the large intestines, the ureter and the urinary bladder. So just from that T1 to L2 region, you're hitting all of those regions. You're going to hit all those regions. And this shows you that as well. Just coming from T1 to L2, here we are getting onto the sympathetic chain. When we get onto the sympathetic chain, we can synapse at that same level. We can run up the sympathetic chain, run down the sympathetic chain. This is happening on both sides. We can synapse at a different level, get off. We can synapse at the same level we came off and get off, or we can jump off without synapsing, creating different splanchnic nerves that have different names, like greater splanchnic nerve, lesser splanchnic nerve, but you don't see pelvic splanchnic, because if you see pelvic splanchnic, those are parasympathetic. And from that, then we can innervate all of these structures. All of these structures. Questions on sympathetic? Kind of have to play with that one a little bit. Okay. So kind of tying this up, what we want to see is sort of the interactions or lack of between the two divisions of the autonomic nervous system. And typically when we look at that smooth muscle, cardiac muscle, and those glands, we're typically going to have dual innervation. So one division is going to excite that smooth muscle, cardiac muscle, or glands, while the other division is going to inhibit it. Typically at rest, what we see, for example, is that the cardiac muscle of the heart and smooth muscle of the digestive tract and urinary tracts receives a dominant innervation from the parasympathetic division. Obviously, though, bear jumps out in front of you, sympathetic division in times of stress are going to be able to override those and take over. But there are a few things in the body that don't have dual innervation. There are a few things that don't have dual innervation. For example, the smooth muscle in your blood vessels only has innervation from the sympathetic division of the autonomic nervous system. Therefore, then, the sympathetic division is going to mediate body temperature, because you know that if you start working out, we're going to dilate blood vessels near the surface so we can lose heat. If we're out in somewhere cold, we're going to constrict those blood vessels near the surface and get the blood towards the core of the body. So we're seeing that sympathetic's in charge of mediating body temperature. But there's a few other things that only get sympathetic innervation. Well, adrenal medulla, well, that makes sense. That one makes sense because we know that the chromaffin cells basically are the second neuron in the pathway. They just never developed an axon. And so there's a second neuron in the pathway for the sympathetic division, so it makes sense the adrenal medulla only gets sympathetic innervation. Well, it's also the sweat glands of the skin only get sympathetic innervation. The erector pili muscles of the skin, remember those? That smooth muscle that attaches to the follicles of hair? And the kidneys. Well, the kidneys are basically functioning because of the blood coming through them, and so it kind of makes sense that kidneys predominantly are only innervated by the sympathetic division of the autonomic nervous system. Let's kind of think a little bit about this. When we talked about parasympathetic division of the autonomic nervous system, we talked about that parasympathetic information getting to the head, we talked about it getting to the trunk, so the thorax, abdomen, and pelvis, but we never talked about parasympathetic information getting out into the limbs. Sympathetic, though, we did. We said it jumped into the ventral rami, and then it can get into the brachial plexus, it can get into the sacral plexus, it can get into the lumbar plexus and follow out. Well, think about what is out in your limbs that is associated with the autonomic nervous system in terms of cardiac muscle, smooth muscle, and glands. We don't have any cardiac muscle out there, so just take that off the list. In terms of glands, the big one is sweat glands. Sweat glands, which are important in mediating body temperature. Well, who's in charge of that? And a lot of the smooth muscle is either in a blood vessel or it's in the erector pili muscles. So parasympathetic does not need to get out into your limbs. So the only division that really makes it out into the limbs is sympathetic. So parasympathetic and sympathetic division of the autonomic nervous system, when you think about distribution around the body, parasympathetic is going to stay at the core. Parasympathetic goes to the head, to the trunk areas, so the thorax, abdomen, pelvis. Sympathetic ends up everywhere. It ends up everywhere. And it kind of makes sense because it's going to be your one that's going to kick in times of stress and try to protect you. So these last two charts that you see here are going to go through all of the smooth muscle, all of the glands, all of the cardiac muscle that's around the body and say, what are the effects from these two divisions of the autonomic nervous system? You don't have to sit here and memorize it, you just think about it. Think about what you would want to happen in your rest and digestive system activities. What would you want to happen when a bear jumps out in front of you when you're walking across campus? So let's think about the iris first. The iris, the smooth muscle in the iris, which changes the size of the pupil. Parasympathetic division is going to be your rest and digestive system, so it wants to protect the retina, so it's going to constrict it. While if a bear jumps out in front of you, you want as much information about that bear as possible. You're going to dilate that open and let in as much information about that as possible. What about the ciliary muscles that change the shape of the eye? Parasympathetic division is going to stimulate the muscles, which result in bulging the lens for close vision. And so we're going to be able to look at things up close. We're going to see that sympathetic, on the other hand, is going to do it for far vision. So we want as much, again, information as possible coming in. Think about different glands around the body: nasal, lacrimal, gastric glands, pancreatic glands. All of this is housekeeping activities. And so we're going to see the parasympathetic division is being in charge of that. Bear jumps out in front of you, you're not so worried about digesting your McDonald's hamburger at that point, and so it's going to inhibit a lot of that secretory activities. Same with the salivary glands. Sweat glands, no effect from parasympathetic, only innervated by sympathetic. Adrenal medulla, same thing. Rector pili muscles, same thing. Heart, we see that the resting heart rate is lower because of the parasympathetic division. It slows down the heart rate. Makes it cause contractions that are not as strong. While bear jumps out in front of you, you want that blood pumping, and you're going to speed up the heart rate, and you're also going to speed up the force of it. We're going to think about things like the lungs. If we think about the lungs, we're going to constrict the bronchioles and make them a little bit smaller. But bear jumps out in front of you, you want to open that up and let as much air in as possible so you can get as much oxygen exchange going on as possible. Digestive tract organs, basically what we talked about before. Here's your parasympathetic division, that's your rest and digestive system, so this is going to activate it. Bear jumps out in front of you, you're going to slow that down. Things like kidney, little or no effect from parasympathetic, and it's because when you look at the kidney, most of the kidney activity, and we've talked about this, is because of the blood coming in. Blood pressure, flow, a lot of that is controlled by the sympathetic division of the autonomic nervous system. So don't just sit here and memorize this. Think about the situation. What would you want to happen in those particular situations? So this is actually from the textbook, and so this kind of wraps up that information. And so you can see those different activities here. These are some of the most important ones, isolated, so you can take a look at those, and you can see also they're telling you a little bit about position of the cell bodies and origination, where the second cell body is located, and what the general effect is going to be. Remember, it's always important to know where the cell bodies are located, because if something happens to those cell bodies, the whole neuron dies. They're in very protected locations for the most part. And so it's important to understand where the cell bodies are for both the pre-ganglionic and post-ganglionic, or presynaptic and postsynaptic neurons. Does anybody have any questions?